Hello, everyone. Welcome to our webinar today. My name is Becky Bongiovanni. I'm the co-founder of CarePatrol. My husband, the founder of CarePatrol, Chuck Bongiovanni, is an MSW, and he began his career as a home health social worker. You know, CarePatrol was born out of the need to provide healthcare professionals with post-acute care solutions at all levels of the care continuum. And our mission is to help your patients find safer senior living options. We know that case managers are always looking for resources for their patients, especially during COVID-19. And we understand the stresses that you are faced with on a day-to-day basis. And we want to share a few ways that we can support case management and discharge planners during this time. Today, I've gathered a few of my all-star certified senior advisors to join me. And we're going to start out with Paula Sotir of Baltimore, Maryland.
Thank you, Becky. Hi, I'm Paula Sotir. I am the founder of CarePatrol, Baltimore's franchise. I've been a nurse for over 40 years. That's always really hard to say. I have a master's in general administration. I'm a certified senior advisor, and just last month I became a dementia trainer. What I'd like to accomplish over the next 10 or so minutes is really to talk about 4 different things. The first thing is, there's a great company called the Advisory Board that has really looked at how COVID-19 has affected discharge, particularly through hospitals. I'm going to talk about a real case study. I'm also going to discuss how the assisted living placement process has needed to pivot during this pandemic, and a little bit about feedback from clients. You know, prior to COVID-19, there were a lot of different multiple priorities that case managers needed to think about when discharging. It's been pretty amazing that it was complicated before. You had to figure out the capacities of post-acute care as well as their capabilities. You had to figure out how quickly you needed to discharge. And if you were patient was in observation, then it might need a discharge in 24 or 48 hours. There's always different staff preferences, different family preferences, and finally, there's socioeconomic factors. And they can really guide you on your discharge plan, because sometimes folks need to go to skilled, and then maybe they need long-term care, and they may or may not need Medicare. So that's really, really been difficult for you guys pre-pandemic. Now we're in the pandemic phase. And guess what happens? You have to know which sniffs are taking clients. You also have to know, do they have available staff? Then if they have available staff, do they even have a place where they can isolate? You have to realize what testing requirements there are. And then finally, how, if you discharge home, does that put the family and the patient at risk for the virus? So that's one thing to think about. The second thing is really trying to understand, why do certain sniffs have more COVID than others? Well, the advisory board looked in California, and they really tried to compare the CMS compare scores versus the outbreak. And what they found is the lower the score, the higher the outbreak. But then leading experts said, wait, that's not right. We have to look at the link between facility size and the COVID prevalence in that community. And what they found out from 20 different states is that the larger the community or the facility, and the more prevalence in that area, then you were going to have more COVID. I have to tell you honestly, that's what happened in Baltimore City. We have really large sniffs, and we had a lot of prevalence of COVID, and sure enough, those skilled facilities were really affected. You know, it's easy to be a discharge planner in a hospital and not understand exactly what point of view the rehabs have, right, or the sniffs. And it's hard because they have 2 options. Do they accept admissions or do they not? If they accept admissions, then what they're trying to figure out is, are they putting their other residents at risk? And if they do have increased COVID, what are they doing with the community trust in that area if there's an outbreak? So they say, well, we're at risk if we accept admissions, or they don't accept admissions, and all of a sudden that long relationship they've had with the hospital could actually, could be broken. So they're really having trouble trying to figure out what to do. And I've seen that again in Baltimore, and they're struggling trying to know how to weigh both options. Where I've seen the most stress, though, is with families. Where do they discharge? It doesn't seem like there's a clear path of safety in any of them or all of them, or there is safety in all of them, and it's really hard to figure that out. So let's just talk about sniffs. So sniffs, are they available? Are they accepting clients or patients? Is there a COVID outbreak? Can the family visit? You say, oh, I don't know if I want to do that. Well, let's talk about home care. Is there availability of caregivers, even through home health or in-home care? What is their COVID policy? Can they actually accept the advanced level of care of their loved ones home? Can they walk up steps? What can they do? And then what is the PPE for the caregivers going in? Do they have enough? And do they know how to wear them? So now we say, okay, let's look at assisted living as an option. Well, who's accepting the clients? Do they have a COVID policy? Are there any outbreaks? Do they do PT and OT? And are family visits allowed? So what I have seen is that these are really, really challenging times, and we need to have more communication. We need to have more assistance to the families and the patients. We need to have more local, real-time information, and it changes daily. And then all of us need to have more empathy, and because emotions are high. What I found is that folks' coping mechanisms are already at a high place. They've already spent time trying to figure out, how do I take care of my loved ones? How do I actually homeschool my kids? Has someone in my family lost their job? And now you add this loved one that is in the hospital and they have to discharge. So it's been really challenging for clients, for sure, over the last 3 months. I always like to start with a case study to really understand what we have done. So I had a client named June. She was 59 years old. She had sepsis. It was really, really difficult. She'd been in and out of the hospital over the last months. She had unfortunately had one leg amputated. Her only leg had a stage 4 wound, and she decided that she didn't want to have it amputated. She had had a father who had a bilateral amputation, and it didn't go well. So the rehab, the sniff, called CarePatrol in, and they wanted us to really talk through what kinds of discharge options there were. And so in Maryland, the regulation is, if you have a stage 4 wound, the only way you can be admitted to assisted living is through if you have hospice. So the doctors and the social workers did have a conversation with June, as well as the husband, as well as the sister who lived out of state. And what was recommended and what June wanted is, she really wanted to not die in a nursing home. What she said is, for my wish is that I can go to an assisted living, and she knew that the outcome was not so good. So her wish was granted, and there's a picture of me on the right. I stayed there to help her actually transfer from the sniff to the assisted living. It was nice to see her. I explained that the room was ready, that the bed was there, the wheelchair was there, that the community was looking forward for her to come, and that they were planning on giving her a shower on the day she was there. It was nice to really see her smile, and honestly, I was so happy to be able to grant her wish. You know, the process for placing has really changed over the last 3 months. We've had to pivot it, and that's a word I know you've heard a lot. First of all, we had to find new ways to complete our care discoveries. Usually when we get a patient in the hospital or the SNF, what we did is we would go to those respective sites. We would talk to the nurse, the occupational therapist, the PT. We talk to the social worker. We'd see the patient. We'd talk to their family. We gather all this information. Well, what's happening now is, unfortunately, the care managers or the case managers at hospitals are doing all of this, and we know it's really difficult, but all of us need this information to help your patients. We have to have a daily log of assisted living openings. It literally changes every day, and we have to know which assisted livings are opening. CarePatrol also wrote a letter to the governor. When the pandemic first hit, what happened is, I know we didn't have a lot of tests, but we had patients that were being discharged from the hospitals, and the assisted living said we needed a negative COVID test. So we had to ask the hospital to do that, and they didn't either have enough or they weren't asked to do it because you had to be asymptomatic. Well, I know CarePatrol is not the only one that wrote letters, but finally the governor understood, and he's now allowing hospitals for clients and patients who are asymptomatic to get COVID tests. And then we're lucky to be in Maryland. I know a lot of other states do this, but every Wednesday we get information on which nursing homes or sniffs or which assisted livings have an outbreak or have any COVID. This has been really good information. It's information I give to our clients so they know. And we are up to date on what's happening in all of these sites of service. You know, it's tough. It's been overwhelming. I think you've heard me say that a couple times. We've had to narrow down the choices for clients. We know which assisted livings are open. We know their capabilities. So we narrow down the choices, and then we complete virtual tours or videos. Now, CarePatrol actually has been doing videos for 4 years. So we've had that as a way to help people understand the differences of assisted livings. But we really had to support the residential assisted livings on how to do virtual tours. We wanted our clients to know that this little assisted living, what it looked like, what the manager was, you know, what the room looked like, so that they could make a decision without ever going there. And it has worked fairly well. We have had to have a plan B, and what I mean by that, so that we meet the discharge date for the hospitals or the SNFs. What I'm finding and what I have found, and this happened 2 times last week to me, is that the family had decided on assisted living A, and last week assisted living A had a COVID, and they have to close and not accept clients for 14 days. So we now have a plan B because we want to be able to meet the discharge date. We also have been over communicating the COVID process in the assisted livings to both the clients as well as the case managers. We want to know which ones quarantine, which ones eat in the room, how do they get PPE to their staff, how has there been prevalence of COVID, has there been unfortunately any deaths. That communication is open, and we are part of making sure everyone can make decisions with data. I think for me, one of the things that has been wonderful through this process is that I have built amazing relationships with case managers. We talk all the time. It is much harder to coordinate this, and so it's been wonderful that CarePatrol can help the case managers in the hospitals. We have been really trying hard to balance the day of the negative COVID test to be the day of discharge or placement. And that takes a lot of coordination. And we've been, pretty successful in trying to do that. You know, I've been doing this for 6.5 years, and I have to say the last 3 months have been the most difficult time we've had in placing clients in safe areas. It has, interestingly enough, been the most rewarding. Here's one of our clients said, "I can't begin to tell you how helpful CarePatrol was for me during the pandemic and finding an assisted living for my dad. I wish I had known about this service when my mom became ill." You know, it takes a village. The village has been the case managers, the doctors, PT, CarePatrol, social workers. And I have to say that I'm very honored to be part of the village that has helped place so many people during this pandemic. Thank you, Becky.
Thank you, Paula, and thank you for the work that you and your team are doing to make a difference.